In part 2 of issue 8 of the Brain Discovery series, Dr. Nedd and Sarah sit down and discuss the treatment modalities they established, which helped alleviate Sarah's physical, cognitive, and neurobehavioral symptoms.
I'd like to focus on what we did to treat you for this dreadful condition, as we called it in times past, when we had a discussion. You were suffering a lot. You were suffering a lot. And we had to come up with a way of saying, how do we effectively treat you? And you're at a point that your wit's end.
Yeah, basically.
At your wit's end. So let's talk about the approach we took. And it took a little while for me to convince you about that. So I remember when we gave you the first nerve block. And again, we onto the physical symptoms. And that's our approach. We tend to start first by treating the things that bothers the patient the most. Because if we get rid of those, then you start feeling better. Okay?
Yeah.
So the first thing we did was to try and get rid of your headache. And we did some nerve blocks where we used some anesthetic and a little bit of steroids, and we put that medication in the front by your eyebrow to block two nerves, and then we did it in the back of your head to block another two nerves on either side called the occipital nerve. It was something that got rid of that type of headache instantly.
Yeah.
And of course, we use some other medications. We use something called nifedipine, which is a drug that helps to stabilize the blood vessels in your brain, and that helps you with the migraines. How often would you say you get a headache now?
Now it's not often at all. Like, I barely get them.
And they're not as disabling as before.
Oh, not at all. It's just, let me just take like 2 Motrins and like I'm good to go.
So that was one. We got that taken care of.
Yeah.
So we kind of got the checks, right? We're checking them out.
Yeah.
So the first one was get rid of the headache. Second one was really a big trigger for your headache was the dizziness and the vertigo and the spinning sensation when you went out in public and so forth. So we put you on a drug that a lot of people think is not good for brain injury patients, but it'll work like a charm. And that was clonazepam. In your case, you really needed something to suppress this effect of multi-sensory stimulation. So all the light, the noise, the motion would trigger your symptoms. And we started you on a very low dose of the clonazepam, and that really helped there too. And there's one drug that we use that I often use in my practice called lamotrigine or lamictal. It's an anticonvulsant medication. And one of the symptoms that we had some challenges was that body cycle problems, the energy cycle, the sleep-wake cycle problems that you were having, trouble falling asleep, the ruminating thoughts, you couldn't shut your brain off. Tell us about your experience with lamotrigine when we started that medication. I know it took a while to get up to the level that where it was effective. I think you told me one time that drug really changed your life.
To go from not sleeping to being able to like sleep, not just sleep, but like a real good night's sleep. Like talking about the like sleep straight until your alarm goes off in the morning. To have that after not having that for so long was just like phenomenal.
And the one thing I think we talked about was you didn't dream before lamotrigine, but you started experiencing dreams, which was amazing, which again represents your ability to get REM sleep, and that's one of the amazing benefits of that medication when you use that. Now there's a third drug we use that you take now, and to kind of bring all the whole thing together to get you where you could now focus and you could now pay attention and get the job done. And return back to society in a way that you could really be effective. And what was that one?
The Vyvanse.
Okay.
That one, I think when our follow-ups, I took it, and I think the first thing I said to you was like, I felt like I was in the zone. Like I was able to sit down at home, like with all the distractions, like on my computer and just like work. I was so focused, like so motivated. Just that like feeling of like just being productive and just like getting things done and like having no distractions or like having no problems focusing, like that was like an amazing feeling.
And to summarize, basically what we did was first properly classify what you were experiencing. the physical symptoms. We were able to identify those. Those of having trouble with multisensory integration, vertigo, noise, triggering headaches, motion triggering dizziness and vertigo. Then the whole issue of the body cycle symptoms where you had no energy or you couldn't fall asleep. Those are all physical symptoms that you were experiencing together with the headaches. So on a hierarchical level, we first treated that. And you got an amazing response, right? We treat that first. And the second thing we went to was using lamotrigine to treat your body cycle issues and help you sleep. And once you started getting your brain organized, guess what? You started feeling better. And so some of the anxiety went away. We used clonazepam both to help the vertigo and so forth, and also we used it to help with your anxiety. And finally, we used the Vyvanse to help with your attention and your ability to concentrate. So this cocktail that you've had has gotten your life back, which is kind of amazing. And certainly medications are very important in helping to balance the brain and the nervous system. But you had therapy. You've been through both physical, occupational, you work with neuropsychologists and so forth. We use a combination of both medications and therapeutic modalities to help you. And so tell us about that experience also.
I think sort of me like understanding more of like what's going on and like the purposes of what the symptoms are and like how we're combating them and how like the medication is going to be like helping them. So it's not just like, here's this, like this is that, whatever. It's like actually just like going through it and just like me realizing like what is going on.
So basically we're talking about an organized way of both classifying and using a methodical way of treating this complex problem. And it seems novel, but it's really simple. And look how effective this has been, but you could be here today talking about your experience. And so I want to congratulate you in this regard. So in closing, the last word is yours.
I would just say that I think through all of this, I learned just how important like your head is. Like you could break an arm, you could fix that, but like you can't come back from like a broken head. And that like to live a long, healthy life, like you sort of need a fully functioning brain. So I think that even if like riding horses is something that you love, is it worth putting your life on the line for?
Well, Sarah, I want to really thank you. You know, sometimes you don't realize that when you go through a negative experience that you find purpose. And I could tell you just, you know, our own interaction and how we've seen each other in terms of me being your physician, I have learned so much from you, and I hope those out there could learn the same.
I want to thank you because I've literally told you a million times, you have like actually changed my life, and I would not be here if it were not for you.
Well, thank you. I have to get the tissue in a minute. I appreciate it. If you enjoyed this video, please subscribe to my YouTube channel.
You can also stay updated with Dr. Nedd on his website at concussiontbi.com and on Instagram and Facebook.
Thank you.